Ma'am, please start. Yes. So, good evening, everyone, the esteemed dignitaries, my dear colleagues, and all those who have joined us today on the virtual platform of Maha IP on the occasion of World Autism Awareness Day, which is celebrated globally on the 2nd of April. So, according to Indian statistics, an estimated 1 in 68 children are affected by autism, and around 18 million Indians are on the autism spectrum, and the prevalence is on the rise. So, there is a need for increased awareness regarding autism and better research to improve the quality of life, not for these just for these individuals, but even for their families. So the theme for this year is Advancing Neurodiversity and the UN Sustainable Developmental Goals. So to take us through this session, we have with us an excellent panel of experts who have been working diligently in this field since more than 2 decades. But before we start with today's program, I would like to invite the President of Maha IAP, Dr. Sanjay Pakmode sir, to give his welcome address.
Namaskar. Good evening. Good evening, respected President-elect 2025, Dr. Neelam Mohan ma'am, our Secretary and Dynamic Secretary, Dr. Amol, and Convener, Dr. Sanjay Deshmukh, Vice President, Dr. Pankaj Agrawal, and Women's Week Chairperson, Dr. Jaya Shivalkar madam, Co-Chairperson Amog, and Convener Kashmiri Badpade. And all the people, Dr. Devendra sir, Dr. Arora sir, Dr. Jitendra, and all the Maha IP office bearers and today's attendees. The 2nd of April, we celebrate the World Autism Awareness Day. Before the start of the program, we are just discussing the World Autism Awareness Day every year is celebrated on the 2nd of April. United Nations in 2007 has declared this day, particular day, as a World Autism Awareness Day. So that means about the autism, we spread a lot of information in the community so that they can become acceptable members of the society. They can be included in the elite society, and even to help their families to lead their life or live their life comfortably. So they will not remain in isolation. So that was a theme behind, and the madam Amog has already told about 2025 years theme, and especially we got a wonderful faculties like Jaya Shivalkar madam, Samir Dalwai sir, and Kashmiri madam. All the three people are doing the extensive work in this field since last few years, and because of their extensive work and their commitment and dedication, we every year, day by day, we are seeing good results. And because of the good results, the other families who were not taking the treatment initially, now they are coming in the streamline. They are taking the therapy. They are seeing the result of therapy, and after the result, this is like mouth publicity. They are telling the other people who are suffering from the similar disorders, and so we get plenty of patients who are in need of the therapy. Initially, it has been the way we think like everything is treated with the medicine, but in autism, it is not like this. Nothing is treated like we need hardly any medicines. What we need is the family support from the other people's, our society, and the means the way he should believe in the therapy. That is the thing we all need. Let us hear from all the experts from today's program, so that we'll get enlightened on this particular topic of that is, and will definitely help us in our practice, because we know the early intervention will give the wonderful results. If we are making a delay in diagnosing and treating this patient, then I think we are doing something not better or harm to the patient and family. In the initial days of the practice, we always see we are a very means fresh in the practice, and sometimes with the days gone, we become mature in the practice, and we find we made few mistakes in the past in early diagnosing these patients, because the high index of suspicion is needed for these patients. Some time is needed when you see your patient in the OPD, and unless and until we invest that particular time and we diagnose such patients and refer to the proper doctor or proper specialist or proper therapist, then only we can expect a result. So we can also add to the betterment of these patients and their families. Over to Amol.
Thank you, sir, for those words. I would now like to invite Dr. Amol Pawar, Secretary General MAHA-AP, for a few words.
Thank you, Dr. Amug ma'am. First of all, I would like to welcome our President-elect Madam, Dr. Neelam Mohan ma'am, then past treasurer and very dear friend, mentor, Dr. Samir Dalwai sir, senior developmental pediatrician of the country. Then also my co-EBs, Dr. Devendra Sarin sir, Dr. Ajay Arora sir, Dr. Jitendra Gawane sir, Dr. Sanjay Pakmode sir, then MAHA-AP chairperson, Dr. Jayashree Shivalkar ma'am, co-chairperson and today's moderator, Dr. Amok Shane ma'am, and convener, Kashmiri Badbade. It is just a coincidence that first time in last 4 years, we are celebrating Autism Day webinar with 3 developmental pediatricians of the some few of them are working in Maharashtra, and Samir Dalwai sir happens to be working in Maharashtra, Gujarat, and but he is getting patients. He's treating patients from all over patients who are coming from all over India through his setup, and empowering autistic voices. This has been the today's this year's theme for Autism Day, and slogan being "I am different but not less." So already Sanjay Pakmode sir has elaborated extensively on this subject, what to do, what not to do, and when to refer the patients to the therapist or the developmental pediatricians. So without wasting time, I will request Dr. Amok Shane ma'am to move further and introduce Neelam Mohan ma'am, and as well as for her words. Thank you.
Thank you, sir. Before we go ahead, I would just like to request Dr. Sanjay Deshmukh, convener of MAHA-AP, to speak for a few words.
Good evening, all. Welcome to the MAHA-AP academic platform. As a convener MAHA-AP, I'm very happy and we are honored to have our President-elect Dr. Neelam Mohan ma'am on this World Autism Day awareness program on MAHA-AP platform. Friends, everybody has rightly said, autistic kids needs special attention, not only by intervention, but by education and awareness. And we are happy we have the team of all developmental pediatrician on MAHA-AP platform, Dr. Jaya Shukar madam, Dr. Kashmiri, and our own stalwarts, who is a pioneer in the neurodevelopment, and Dr. Samir Dawai sir. So that's a great beginning, and we should congratulate our MAHA-AP team, Dr. Jaya ma'am, Dr. Amok, Dr. Kashmiri, our president, Dr. Sanjay Pakmode, secretary, Dr. Amol Bhau. I personally think the awareness in the pediatric is going on since years, but now it's time come to give awareness to the teachers and school, because that is a platform where we can make sure, because of the social stigma, they never come up to you. And I'm very happy to say in Nagpur, the municipal corporation has started one of the best comprehensive centers in Nagpur, and we will have one sanitation there day after tomorrow. So now we have to make the policy holders to accountable to make sure they will get the benefits of all the facilities for such autistic child. So welcome all, and I am thankful to all the faculties and all the office bear who joined today on this autistic celebration day. Over to Dr. Amuk. Thank you.
Thank you so much, Dr. Sanjay Deshmukh, sir. I would now like to invite our chief guest for today's session, the dynamic, charming academician and pediatrician, Dr. Neelam Mohan Ma'am, President-elect Central IIP 2025, to bless us with your words of encouragement.
Yeah, am I audible, dear?
Yes, ma'am.
Yes, I'm audible, I assume.
Yes.
Yes, ma'am.
Okay, at the outset, I would sincerely like to congratulate the Maharashtra Pericon team. I guess they have been performing stupendously well when I'm seeing the way the programs are coming, the way they are connecting with the with people. It's really praiseworthy. And the more I get to see and hear Sanjay Pakmore, so the more I admire his abilities. So I would like to start with congratulating Sanjay Pakmore and Amol for this lovely evening today, where you could think about, uh, not only that we have words like Samir, Jaya, and Kashmiri to talk to us about that. But I hope if this programming through the YouTube, there are a couple of facts that you all want to emphasize. And that facts look to me in two ways, which is not only are we trying to say that every child is unique, every child can be different, some communicate differently, and so what? That's okay. That's at one end. We are talking about the neurodiversity, and we are talking about empowering them and including them in day-to-day life. And this is what, as there has been progress in the field of medicine in India, I can see that we are talking today of autism, but the same subject was not being discussed almost a decade back, and our experts who've been working in this need to be congratulated because the awareness was so less, and yet you all have been working. As a country progresses, we move from things, and that's what UNSDG talks about. We move from something which bother everybody, and the basic vaccinations and infections. We move on to involve and include such fields. But for those parents who are listening, I would just say that if your child is 1 year and is not responding when you call or doesn't show good interaction, or if by 18 months the baby is not speaking a few words, or when you doesn't point to show interest or is playing with the same instrument when the child is a little older, or making some repetitive signs, here we are as pediatricians trying to alert and say that this could be the red flag signs for developmental concerns like autism. Uh, it it we are not saying that it is abnormal, but whatever we are saying that if these people, if these children can be identified early, then intervention can make a world of a difference. And if you notice any of this, please don't delay. There are whole group of pediatricians who are now being empowered to identify this and to help you all in dealing with it and the transition of these children, whether you go into school or in different aspects of life. And all that I have to say is, if you go retrospectively of some people whom you never thought, today the world thinks that people like Einstein, people like Isaac Newton, people like Mozart, and Nikola Tesla, they were autistic. We have seen what Einstein and Newton has done with their theories, but some of you who wouldn't know Mozart, I mean, you have to visit to see what music he played, though he lived very short, less than 3 decades. But the impact to play in power in front of, the uh, I don't know what you would call the so-called elite people in those times, and Tesla, who gave us the current. So these are some people who performed so well. So when you get to hear that they are autistic, and I think the Hindi movie, I'm forgetting the name, but my favorite Shah Rukh Khan, was in it along with Kajol. He also played an autistic. If I'm not mistaken, Samir, that movie, My Name is Khan,
My
Yes,
name
was
is
yes,
that the
Khan.
one?
yes, yes.
My name
That's
is
right.
Khan.
That's
Yeah.
right.
So
My
My
name
Name
is
is Khan. I think everything about Shah Rukh Khan I need to know. And that was one movie which talked a lot about how he was an autistic. And so they may be a little different. And you have Oscar winning actors and all who are there. So I salute the team, the entire team, and I welcome some other stars who've joined us, like Sanjay Deshmukh, Devender, Ajay Arora, besides the faculty, to appraise us, to enlighten us more on this, how we can. And I thought globally they've been talking about something like 1 in 150 or 100, and the data of India was not really clear, but I was pretty surprised to see a more giving some data which is less than 100. Maybe it was a study in an area, but yes, it is time for us to visit and look into these areas and work for these children. And, you know, thank you. With that, I hand over the organizers, and thank you all for this opportunity to connect. And before I leave, I would just say, please don't forget that autism and gut are totally connected. It has been seen that 60% of the autism kids who have behavioral disorders would have something to do with their gut, the gut microbiota, allergies, and gut related issues. And last year, I had started the first of its kind once a week autism and the gut clinic. It didn't kickstart much because we don't have smart people like Jaya and Samir and Kashmiri to support us. But yes, I think there's a lot to be work done in this field too. Thank you.
Thank you so much, man, for those pearls of wisdom. And we would really appreciate if you stay till the end of the program for your expert comments. Moving on to the session now, I would like to introduce our first speaker for today, Dr. Kashmiri Badbade, who's a developmental pediatrician from Kolhapur. She's the director of Tender Steps Child Development Center. She's also the convener of Maha-IP Women's Committee 2025. And Madam has conducted many modules on high-risk newborn assessment and tiny to tall obsess in multiple central IIP programs. And she will be enlightening us about autism insights. So, Dr. Kashmiri ma'am, I welcome you to start with your session. Ma'am, you're muted. Please unmute.
Thank you, Dr. Amok. First of all, I thank MahaIP and IIP for giving me this opportunity. So today I'm here to discuss a little different because ma'am has given me a different topic. So, my slides are visible.
Yes, ma'am. They're visible. You can put them on full screen.
Yeah, it is. I have done that. You can see that.
It's not yet on full screen, ma'am.
It is full screen.
Yeah, now it is
Pallavi
full
ma'am?
screen. Yeah.
It is full. Yes, ma'am. It is
Yeah.
full screen
Yeah.
now. Yes, ma'am. Thank you.
So all the dignitaries on the dais, I thank first the MahaIP for giving me this opportunity as we are celebrating the Autism Awareness Day. And all of us are conducting a lot of programs. So this is also a unique initiative here. All the topics which we have decided today is something different than the regular autism, which we talk usually. So autism insights. So as just now, madam said that how the child presents. So we have the overview of the autism spectrum disorder, the how child's present, not giving response to to call, poor eye-to-eye contact, social communication delay, restrictive behavior, repetitive behavior. So all this overview we have about the autism. Then the importance of the individualized assessment and the interventions that we are trying to focus on. Then also we have seen that the rising the prevalence and improves the understanding of the autism, that we are diagnosing more and more autism nowadays because we are coming across with that parents are coming little more, the awareness has increased in the population. Then the importance of the early diagnosis and early intervention. So early diagnosis and early intervention is very important for the prognostication and for the betterment of the child. So what we have to do now, so rethink on the autism, that we know the deficits of the child. Now we need to focus on the strength and the potential of the child. Then autism as a neurodiversity rather than the disorder. And it is important to have a individualized intervention plan. Every child needs a different protocol. Not the same protocol will fit for all the children. So as we have seen, the core symptoms, we all know these core symptoms, that's social communication deficit, restrictive interest, repetitive behavior. Then the variability in the symptoms, like the eye contact, hand flapping, speed delay. Also associated symptoms like anxiety, sensory processing issue, GI issues, sleep disturbances, ADHD, then the emotional regulation challenges, and the motor coordination and executive function difficulties. That the core symptoms we come across usually. So what beyond the classic symptoms? So the spectrum means the unique profile, not a one size fit all the approaches. So every child needs a different approach. As we say that the developmental domains like the motor, fine motor, language, cognition, along with that here, like we need to concentrate on these domains like the social, sensory, cognitive, and the motor also. Then the recognize the internalized symptoms in the autistic individual is very important. Impact of restrictive interest on the daily functioning. We have to see the how the child is functioning in day-to-day basis. And as Neelam madam said just now, the spectrum ranges from the Einstein to someone who has no language or with intellectual disability. When I first came across with the girl, I was very amazed to see that the girl used to tell me the exact day if I give her a date and the year. If I say the 5th May 2025, she used to say, yeah, it's Monday. If I say the August 26, so she will say like 26 May, क्या है अगस्त के वो 5th तारीख को, तो he will say that, she will say that, oh, it's Sunday. So I was amazed to see her abilities 10 year backward forward. I tried everything. Then I feel very bad ki, Arey, what I'm doing, I should not try this. Then there was one more example, that one girl, she used to talk, she was obviously she was a media addict, but she learned Korean language, she learned Russian language, she was very fluent in English as well as she is very fluent in Hindi. So all this variable range we come across with. Then the autism spectrum, beyond the classic symptoms, we can see the heterogeneity as we have discussed just now. Social impairment in that they range from the aloofness to disinterest in the people, sometimes even in the parents, and a desire to socialize, but with the limited and inflexible social judgments. Also, in language, the range completed from the lack of spoken language with the very impaired language comprehension to the structured language that is within the normal range but affected by the impaired social judgment. And the intellectual from the intellectual disability to the superior cognitive functioning. Then comes with the sensory processing. We all talk about the sensory processing. So we know that the sensory processing, stimming, hypersensitive, hyposensitive, meltdowns, we come across with all these words affecting the daily life of the child. Also, we heard about the importance of the sensory friendly environment and occupational therapy. And the tool like the sensory integration therapy. So is this the only role of sensory processing in the autism? No, there is something beyond that. So like the sensory sensitivities are the core challenges, not the secondary issues. Always it has been seen that the sensory issues has been tackled later, but believe me, it's a core challenges and we need to address it as early as possible. Then how the sensory workup guides the intervention and accommodation, we need to look into it. Then tool like the sensory integration, as we have discussed, integration therapy and environmental modification accordingly. Then differentiating the sensory seeking from the sensory avoidance, and importance of the individualized sensory diet, we have to do that. Then the patient comes to you. Usually this is what we do, the assessment and the diagnosis. Patient comes to the OPD, we do the physical examination, hearing assessment, then we try to find out the red flag signs, developmental assessment of the child. And then as we know that the early and accurate diagnosis is crucial for the effective interventions, so we try to diagnose, we try to screen whichever the tool is available at your center, we try to screen according to that. These are the standard tool which are available. So we Then again, we also use the DSM-5 criteria. In that we see the social communication, repetitive behavior, early onset, impairment, and exclusion. So all these things are enough? No. In DSM-5 criteria, certain which are not DSM-5 criteria, like the language, atypical language development and the abilities. Depending on the age, less than 6, more than 6, the abilities are atypical language development we can see. Also the motor abnormalities, like motor delay, hypotonia, catatonia, then coordination issues, movement disorders, then praxis, gait, balance. There are a lot of variation we see in the motor impairment also. So we need to look into it. Then the factor affecting the progress in the autism. We really have to keep on what affecting the progress, what can affect the progress. Severity at the diagnosis, long-term outcome. So the severity at the diagnosis does not predict the long-term progress. So if we treat the child, if we give the proper intervention, find out the deficits in him, and if we work on the skill of the child, so obviously we'll get the good long-term progress. Then the role of the family environment, therapy, and the neuroplasticity. Importance of the early intervention and the skill building. The critical role of adaptive skill, environment, and the self-regulation that can affect the progress if we don't concentrate on that. And the importance of early intervention tailored to the individual need. Every individual need a different protocol. So again, coming to the autism girls. So basically the girls get masked because they're imitating. They want to fit in and study and copy others. So camouflaging the behavior and lead to the misdiagnosis. They are socially little more motivated, seeking friendships and put efforts for the socialization. Also, they have the anxiety and sometimes the ADHD like features also. Then the special interest, like they behave like a typical females. So again, the language, they may speak good or they have some delay. Social differences are there, special interest and the routine, age appropriate, but may be intense. And the sensory differences, often hypersensitive, but may not express it openly. So these are the variations which we see in the girls' presentation. Then the comorbid condition. So we need to focus on the comorbid conditions also. Many a time we miss that. Like or if the child is in a spectrum, associated disability or sometimes a specific learning disorders, seizure disorder, ADHD, then the anxiety disorders, sleep, we need to concentrate more on the sleep. 50% of the ASD can have the sleep issues, abnormal behavior, eating, feeding disorders, and cerebral visual impairment. So all these things we need to keep in mind when we are dealing with the spectrum child. Then the autism with ADHD, dual diagnosis, it happens many times. So many times what happens is, even sir will agree with us, that the many times the child coming to us at 6 years, 7 years state diagnosis with the ADHD, but that ASD is masked somewhere. ASD was not on the paper somewhere, or not what was not noticed, because maybe because the sensory issues are more, or the ADHD is the add-on dual diagnosis with the ASD. So patient is only with the ADHD and treatment is going on with the ADHD, not ASD with ADHD. So difference in the treatment approach, the medication and the behavior. So we need to diagnose properly. And then the impact of ADHD on the executive functioning and impulse control, we need to take care. Then what? Unlocking the potential, the strength-based approach. So as sir always says that ki manus magna व्हायला पाहिजे. So brain connectivity, the hypoconnective versus the hypoconnectivity. So we need to connect with your child first. Once you are connected with the child, then you work on this core deficit in the children. Then from shifting from the deficits based therapy to the talent or the skill development. So we need to go further. Then encouraging the passion-driven learning and the self-advocacy to the child. Also, we need to work on the functioning of the child, which is very important. In that, the impact of the early intervention and individualized support is very important, and also the structured and predictable environment and the family support is important. Then the regression. It happens so many a times, it is a roller coaster ride, waxing and waning of the symptoms we come across with. So regression occurring in almost approximately 30% of the spectrum children. causes could be the immune response, mitochondrial dysfunction, then the environmental triggers, and differentiating between the we need to differentiate between the developmental delay versus the true regression, and importance of identifying the red flags for the regression. A child is doing well and suddenly child is showing the coming back to the square one. So these are the usual complaints. Then the role of the metabolic and the genetic variations like the Fragile X we need to rule out. So coming just a small intro of Fragile X. Fragile X is a genetic disorder which shows the behavioral symptom just like the ASD. And it is the most common single gene, causes 2 to 6% of the ASD. So we need to rule out really. Then intellectual disability is common in Fragile X and can complicate the ASD diagnosis. Also, the severe ID may present the challenges in the social development resembling the ASD characteristics. And accurate diagnosis require the careful assessment to differentiate between the symptoms arising from the whether it is a Fragile X, intellectual disability, or ASD. We need to differentiate them. Then the importance of the sleep and the diet. There are many papers on the melatonin therapy. Some shows evidence, some shows limitations. But like along with that, we have to work on the behavioral intervention for the sleep issues. Also, we need to focus on the nutritional deficiency and dietary modification. Then gut-brain axis and its implementations, gluten-free, casein-free diet. So like every child doesn't require a gluten-free, casein-free diet, but some, if they are sensitive, then we may have to go for it. It has its own evidence and limitations. Then the breaking the barriers. So shifting from the accommodation to the full participation in the school and the workplaces, we have to look for the peer mentorship and the social inclusion. Also, the importance of the neurodiverse friendly education model we need to set. There are very less in our country. And moving beyond the clinic based therapies like community driven inclusion and creating a sensory friendly public places. We may have to, it's maybe 10-year down the line we will say, or 5-year down the line we can see all these implementations. And also there is a terminology called as a LAD, like losing autism diagnosis, where the child is shifting from the having the autism is now showing the normal behavior, but there are certain things which we have to certain things which we will see that no, there are some symptoms of autism are there, or some restrictions are there. So discussing one case quickly. So she's a 5-year-old. When she visited to me, she was 4-year full-blown autistic child. Now see how nicely she's playing. She's interested in the activities, smile. Also, she has developed with the 2-word sentences and a lot of things where she was behaving good. But then later, meanwhile, the parents thought that now the child is doing well, so she doesn't require a therapy. And then they stopped coming. And then there were a lot of family issues and something. And they found that the child is again started showing the same symptoms and more aggressive, more hyperactive, and not interested in doing any of the activities. Then they have done a lot of investigations and a lot of doctor shoppings and everything. And after 8 months, they again visited to me. And then one day I sat with them and it's like, just tell me the routine. So when I saw the routine was so busy. She used to go 8:30 in the morning and come back 9 o'clock at night. Then I have seen the major changes in her routine because the school has been changed now, because that time she entered in the first standard. Then also the therapist, the speech therapist has changed. Then the role of special educator has come in, and that was not been discussed with us priorly, or was she has just mother had just started with it. And then the gym was there, the lot of sound and all that. It's a big gym and loud noises, so a lot of things were there. Then again, one day when we again restarted with the therapy, my therapist said she was trying to throttle herself and she was trying to harm herself. Then again we sat with the mother and we took the history. Then we realized where the patient, her child is also autistic. He is around 17-18 years, and he was trying to bully her. He was trying to hit her. He was trying to beat her, and then she used to go in the corner and she used to sit. And then we realized all these symptoms could be this child is a traumatized child. Then we try to remove the traumatic event. So what we have seen in her is regression in the areas like including the language, social communication, abilities to attend and learn, abilities to regulate the behavior, also the negative emotions including the sadness, apathy, irritability, anxiety, fear, aggression was too much, self-injurious behavior was there. Then she was destructive and refusal to go to any place, lack of interest in the surrounding. So in this child, we try to remove the traumatic events, we try to schedule her, and again now she is coming back to the normal. She is coming back to the normal, not yet completely came back. Then we really have to work on the functioning of the child. So international classification of functioning ICF model. So importance of the environmental adaptation is there. So ICF is very important. There are 6 F words, like we need to focus on the fitness, function of the child, friends, whether they are mixing with the friends, participating in the activities, family environment, fun, and the future, where the parent and a therapist see as or we as a developmental pediatrician see them as. So we need to work on this 6 F's. And also I add one more is a finances, because it is very taxing for the parents, not just economically, also the physically, mentally. Then a lot of traveling they need to, and the so much of stress, and every day they have to do the routine. So the 5th F is the finance, and we need to work, we need to consider that also in with the families. Then the holistic approach, as we all are doing, the multidisciplinary approach, the pediatrician, therapist, educator, family-centered approach, the behavioral, occupational, and the speech. But believe me, see, any child coming to you not speaking, don't send directly to the speech therapist. First stick to the brain connectivity. Connect with your child first, and then once the deficit has decreased, then you think about the skills. Then the involvement of the caregiver in the interventions and the strategies. So the way autism is not just a disorder, but a unique neurotype requiring the individualized care. Strength-based personalized therapy is more effective than the generic approach. And the environmental factor matters. The sensory-friendly space enhances the participation. The medical, educational, and psychological is essential, and support the parents and caregivers through the education. Thank you.
It was a fantastic session, Dr. Kashmiri ma'am. You've enlightened us with so many things, and that case presentation was really good. I would now like to invite the chairperson of Maha IIP Women's Committee, Dr. Jaya Shilvarkar ma'am, who is a developmental pediatrician, a child and adolescent psychologist from Nagpur. Madam has conducted more than 100 workshops for parents, teachers, caregivers, and for rehab professionals. And she'll be talking about her own experience on how to guide parents with children with autism. Welcome, ma'am.
Thank you. Thank you, Dr. Amo. First of all, I would like to thank Neelam madam for spending her precious time with us today evening. As well, I would like to thank Dr. Samir Dalwai sir, because in spite of having a busy schedule, he has given preference today to Maha IIP program. So thank you, Dr. Samir sir. Pallavi madam, you can start the slides. So what we are going to see after Kashmiri madam's insight into autism is some practical guidelines, and which I have seen during my own experience since last 25 years working as a developmental pediatrician. We need to go beyond diagnosis now, because diagnosis is now fairly common, and we have parents coming to us with MChat. So pediatricians need to go beyond that, and that is the process which I am going to discuss now. So when I started my center and my practice as developmental pediatrician 25 years ago, it was like, what is autism? There was just a paragraph in our textbook. Is it a really, does it exist? Is it misdiagnosed or it is misdiagnosed? Is it something related with MR? It used to be MR then, now we call it as intellectual disability, or what it is. I mean, even for me, it was a query. And from that, my learning experience and the whole process started. And today we have pediatricians who are specialized in this area, and we have got good screening tools, good diagnostic tools, and now even government has recognized it as a disability, which we usually referred as an invisible disability. And now it is a part of our Rights to Person with Disability Act 2016. And these students or children with autism get the same provisions as other students with disability. So from 25 years ago to today, we have come a long way. So at that time, it was one woman show. And today we have a multidisciplinary team. From no information to we are moving towards flood of information. In fact, many times, many pediatricians would get more information from parents. Because moment parents suspect anything, they Google it, they get information, they want to see because it's their child, they are curious, they are anxious. So they get lot of information, and even in my clinic, they come with like after my history taking, they'll say, "Madam, ये autism है क्या?" So what is fun in telling me them that it is autism, because they already know that it's autism. They just want to confirm from me that it is autism or know what is the level of autism and all that. So now there is a flood of information. But as a pediatricians, are we doing the right thing or are we taking the right direction? That is what we are going to discuss today. So what we need to do is to change the approach towards developmental disabilities, because for years our the approach or the way to handle it कि कुछ भी developmental disability है हमको OTPT के पास या speech therapy के पास भेजना है. But is it enough? And if that is all we are going to do, what is the need of pediatrician also? Because as I already said that parents themselves are diagnosing. So pediatricians need to know what happens to the child once you refer to some therapy centers. Do the parents actually go there? For how much time do they remain with that therapy? Is therapy helping them or not? What reference we have given, is it working or not? And after referring, why do they lose touch with the pediatrician? Do they have any problems while growing up? Do they come back to pediatricians? So all these questions pediatrician need to ask to themselves before just saying कि अभी इसको therapy की जरूरत है, अब इसको therapist के पास लेके जाइए. So something beyond that. Next, please. So what we need to do, because we know everything, but what we convey to our parents is something which we need to work up upon. So there are some facts we need to understand, and there are some myths we need to clear in among ourselves. What usually we tell our parents when the diagnosis of autism or for that matter any developmental disability is done, it has no cure. That is what we say कि इसका तो कोई इलाज है ही नहीं. Autism, if we are talking about it, we tell them there is no medicine also on autism. Therapies are the only answer. And it's a lifelong condition. And if the parents ask what is the prognosis, we say we are not sure. So what are the basically questions in a parent's mind who are very anxious? They want to know these things. But we say no cure, no medicine, only therapies, and prognosis we can't say. So parents are absolutely not happy with this, and they start their medical shopping. Next, please. So what we need to convey to parents as a pediatrician, that autism, we don't say that it is not cured or there is no cure. We say that autism is managed and it is manageable. Of course, how it is managed, that pediatrician will guide the parents. As such, there is no medicine to cure autism, because we have to tell the fact also. We don't want to give them wrong hopes. But at the same time, we have to tell them that if we don't have medicines, even other pathies don't have medicine. Because this is very common, and even on internet, we see so many Ayurvedic medication which are promoting speech language and whatever disability they have in autism. So right in the first, you have to mention it to the parent or tell them that before you take any medication from any pathy, please talk to me, because we don't know whether these medicines are really working or not. So हमारे पास तो medicine नहीं है, लेकिन कहीं भी से लेना है तो you just ask them. That is what we need to tell them. And there are few medications which are helpful to manage the symptoms. That also we have to tell the parent during their counseling. Similarly, about prognosis, we have to be positive and say that be hopeful. And it depends on many factors, what we call it nowadays as a epigenetic approach. And as Kashmiri has just told us before, there are many things we can do as a family, as a community, as a school, as teachers. So that is what we need to tell to parents. Next, please. So the most common thing whenever there is a diagnosis of autism, we say refer to OT, occupational therapy. But before you refer to the occupational therapy or straightforward tell them कि इसका तो बस therapy ही इलाज है, you have to understand that OT is not panacea for autism. Because as we all know that OT basically works on muscle coordination and sensory challenges. And the core symptoms of autism are related with speech, language, communication, socialization, and their other behavioral issues. So sending to OT doesn't deal with all aspects of autism. Approximately 25% face major sensory challenges for which occupational therapy is definitely recommended. But even when you refer for these, you make sure that the autist you are referring is actually working for SIT. Because that again is a specialization among autists, and all autists are not experts in sensory integration therapy. So again, that factor you have to consider. So OT is a part of therapy and not the whole aspect of management of autism. But what is happening that you refer them, and because you have referred them, parents believe us, and considering the charges they pay every day for occupational therapy, what parents think 400 रुपए दिन में दे दिए हैं हमने और 45 मिनट्स का 1-to-1 सेशन हो गया है, अभी हमको कुछ भी करने की जरूरत नहीं. We have already spent time, we have already spent money, and now we don't have to do anything. And that is where we lose connect, or parents lose connect with the child. Because there are certain problems with the OT, that the activities are repetitive, which you don't want in autistic child. Many times there are individual session, again that affects the socialization, and cost is the major factor. So before you refer to OT, you must know these facts. Next. Similarly, the second is, बच्चा बात नहीं कर रहा है, speech therapy के पास भेजना है. So either you send them to OT, send them to speech, their children never come back to you. Why? Because we know that autism displays wide variety of speech, language, communication challenges. It is not that just child is not speaking. Many times child is speaking. So we have children who are non-verbal to autistic children who have excessive talk, which can be in the form of echolalia, which could be repetition, which could be meaningful talk, or it could be meaningless talk. So we just don't want to give them speech therapy. It needs to be more comprehensive. Similarly, we must understand that all speech pathologists are not autism experts. Many times they are DEd or BEd in hearing impairment who work as a speech therapist. So basically, they are audiologists and they are not autism experts. And we need that program needs to be individualized depending upon the severity of autism, the IQ level, and so many other things. So again, while referring to speech therapy, you should know whether it's a speech problem, it's a language problem, it's a communication problem. And because again, the therapies are very costly, and the same thing happens, parents feel speech को हमने भेज दिया है, अभी हमको कुछ भी नहीं करना. So think about it. So what we need to do next? And many times there are many places where OT and speech may not be available also, or it could be so much far away. It's very practically impossible for parents to take them. So what we need to do, and here role of pediatrician is because pediatrician can and pediatrician need to formulate and implement program which involves parent. So we train the parent, and this program includes day-to-day activities based on the principles of OT, which daily activities or even the green gym activities we can give, or sand activities. So many activities we can give on day-to-day basis, as well as interactive program, which includes speech language communication, socialization. We can definitely train the family for it. So it's not only half an hour or 1 hour session for speech. It's a 24 hours program because now parents are involved. And what Kashmiri has told, it develops connect with the child. So here, pediatrician's role is very important. And that is where I think these two are points which we can have a full day workshop. Maybe in future we can have planning for this. कि बताना क्या है actually. But this is what we need to do. Next, please. So what happens if the parents are not guided properly? Pediatrician will lose the patient. This is common experience. Once you refer to OT or PT, they don't come back to you. They will not even come for vaccination or illness because they don't want to face you only. They'll go to anybody else. They'll go to occupational therapies, they'll go to so-called psychologists who is just BA, or so-called experts. They'll go to speech therapies, they'll go to Ayurveda, Homeo, they'll go to even dance therapy, art therapist, or anyone except pediatricians. Why? Because we have lost the patient, where we have failed to satisfy their needs, which are important during diagnosis. So parents get misguided, they get exploited. There's a lot of money involved. The important part of early intervention is lost, and then another set of problems arises with schooling, because as a pediatrician we are not even able to guide them for schooling also. So next. So what other challenges pediatricians need to deal and guide? So we should be able to guide them regarding the education and schooling. Again, these all are a step ahead, which we go beyond diagnosis, and maybe we are taking now workshops for MCHAT, diagnosis, early intervention. Maybe sometime we can include this also and train the pediatricians regarding this. So education and schooling, behavioral management, stress management for parents, also for the child, family therapy, because having an autistic child involves a lot of change in the family dynamics. As the child grows, there are adolescent challenges, certification guidance, genetic and sibling counseling. I will not go in the details because we don't have that much of time, but I have just mentioned this because we need to be aware of this. Next. So pediatrician's responsibility, apart from this guidance which we have discussed, is definitely as and when medications are required, management of comorbidities, which Dr. Kashmiri has mentioned before, investigations which are required, maybe if there are any neurological additional features, we need neurologist opinion, or if there are syndromic features, we need investigation on that ground. As we are talking about brain and gut relation, diet, nutrition advice will become very important. Care in illness for autistic child again is a different thing, because the way they accept medication or not. So basically, pediatrician needs to be a team leader, and much more for a parent. Need to develop that trust with the parents. So whatever problem they may have, they can approach you, talk to you, and you will be able to guide them. Next, please. So the take-home message in today's this, the developmental disabilities, including autism, needs special care. As well, pediatricians need special training to deal with this. And as we are moving a little bit from infection and vaccination, and there are many pediatricians who want to work in this field, many times the therapy setup will not be available so easily. What happens then? The parent go for online therapies, online speech therapy, online OT therapy, online this. So what we want is that child should be away from screen, because they already have problems in socialization, they have problems in communication, and as it is, as like every normal child, they are also into a lot of screen time, plus their therapies are also online. So that becomes an additional problem to deal with this. And what we want basically them to connect with the family, that purpose is lost. So pediatrician can definitely take up this role. You can train yourself, you can train the parents, and family-based therapy. Uh, in family, we have mother, father, siblings, grandparents, maybe relatives, maybe neighbors. So we can involve everybody, and that will be the best therapy a child would get, rather than in a closed room doing same repetitive activities one on one, where child becomes more into himself rather than socializing. So training and practice can empower pediatrician to be an important and primary caretaker of these children. Little bit a separate OPD time and counseling can go a long way in guiding parents. So I would just say that equip yourself to support autism, equip yourself to support families with autism or autistic child, and definitely it will be rewarding for you as a pediatrician, as well as on commercial level, the patient will stick to you and you will also feel satisfaction. So this was my experience over a period of days, and I have developed this parent or family training module, depending upon which needs to be individualized depending upon child's IQ, cognitive level, speech level, and we have seen good results with them. So instead of just referring to OT and speech and that's all, we should move beyond this and help these parents. So thank you so much for giving me opportunity to speak on my own experience. Thank you.
Thank you so much, Dr. Jaya ma'am. That was very enlightening. You've actually given us many practical tips highlighting the importance of a pediatrician in the management of an autistic child and how to maintain the connect, like how you said, being a bridge between the child, the family, and the other specialities they do visit, and equip ourselves day in and day out so that we can guide them better. Thank you so much, ma'am. Now, going on to our next speaker, I would like to introduce Dr. Samir Dalbai. He's a very renowned developmental pediatrician for all of us from New Horizon Child Development Center in Mumbai, who has been passionately working in this field since more than 20 years. And he's been the author of many IIP textbooks on developmental pediatrics and the recipient of many awards. So, Dr. Samir Dalbai, sir, we're very delighted to have you with us today on the MyIIP platform. And you can please start with your session and enlighten us. Thank you so much.
Thank you. Thank you. Am I audible?
Yes, sir.
Yeah, my dear friend and the president of MyIP, dear Sanjay Bhai Pakmodeji, my dear Amol, I can't see him, but I'm sure Amol is around, but more as well as that, very happy to see that Dr. Neelam Mohan, our president-elect, is here, but I know why she is here. It is not for anything else because of the academic importance and the connection between autism and gut. So she has only her academic thing in mind. So let me tell you that. Because
मेरा इंटरेस्ट है
academics,
महाआईएफपी में
academics, yeah, of course, that is your duty, but your interest is academics. Dr. Devendra Bhai, आप भी आगे, thank you so much for you being here, as well as Dr. Jayashree Shivalkar madam, Dr. Amog, and Dr. Kashmiri. What a wonderful presentation, and Sanjay Bhai Deshmukh, who keeps encouraging all of us with his excellent comments, and all the members from MahaIP and from all the different frontal branches of IIP. So I am trying to share my presentation, but just give me a minute. I think the earlier speakers have done a phenomenal job and have taken the discussion of autism to another level altogether. And it's going to be very interesting for me to try and put what they have said in the right perspective so that we can go ahead for the future. And I think it is the first time that we are actually talking about the subject of autism, not from trying to explain to pediatricians what autism is. Because like Jaya madam said, now nobody needs to ask what is autism. But now is the first time that MahaIP has called for a topic which is talking about the challenges for the next decade of autism. And I'm very happy and glad that I was invited to deliver this talk. Is the presentation visible to everybody?
Yes, sir.
All right. So we are going to talk about the challenges for the next decade, but the future always starts by making a great team that works together. And I'm very fortunate that we have a great team of brilliant people, brilliant minds working at New Horizons Child Development Center, and no prizes for guessing why the center does so well when you look at the gender disparity here. So nobody ever accuses us of the gender disparity at the center. I find myself in a very micro minority, and that is the exact reason why we are doing so well. We're going to talk about the evolution, current situation, research, two titles that I like, from cradle to classroom and from cradle to AI, and then the solutions. The whole story, if you're talking about the future, begins with evolution and going back. Because if you have to go ahead, you have to first look back. And the story is about how two neurons connect to each other, and the only power they have is when they connect and hold hands and transfer messages from one to the other. Without it, they're pretty useless. And the entire story has the maximum potential in the first 1,000 days, because look at how much handshake is happening and how much gale milna is happening or gale lagna is happening in the first 6 months to 2 years of life, that there are so many connections between these two chaps. And unfortunately, after 3 to 4 years, they realize that it's no fun being together so much, they start going their own ways. So the synapses actually start decreasing and the potential for development actually goes down. So when we look at the past, before we look at the future, I hope we have all read this wonderful book called Sapiens, which told us that humans evolved over the last 6 million years from the animal kingdom, where genetics actually changed the design of the brain, and the brain was taken beyond the fight or flight reaction that animals have, the autonomic nervous system, where it's either maro, ya lado ya bhago, where you have to either fight or run. And that was what animals could do, but humans developed the frontal cortex and the higher functions like delaying gratification, rational thought, communication, and the ability to think as and for a large group. I am pretty hungry, but I want to finish this talk first. So I will delay the food waiting on the table. I will think rationally about what I should talk to all of you, and nothing that will be nonsense. I have to have the art of communication to you in a way that you understand what's going on. And then all of us need to think together what my IP can do together for autism, and then what IAP as a whole. So the ability to think as a group is rare and is present only in humans, not in other animals. That is why a group of puny humans could hunt a huge mammoth elephant and kill that elephant, because they could all plan the hunt and chase the elephant and drive him into a gorge and kill him. But over hundreds of centuries, our brain adapted itself perfectly to this settled community living, where people lived in communes of 110 or 120 people. Children were born in these large communes and reared in their neighborhoods. And that was the essence of nurturing care for humans. And this is a wonderful picture of Gurudev Rabindranath Tagore in his Shanti Niketan. Look at the way human education was also being done. You hardly see a book or two, no benches, desks to be barriers between children, as Kashmiri was talking about barriers. But everybody is around Gurudev and looking at each other. And this is a true nurturing care in nature with each other. But what is the current situation? There is a total lack of time. The mother, in the half an hour that she gets after the child wakes up in the morning till the child goes to the school bus, has to finish a list of about 25 things to do in 15 minutes or half an hour. And they are the same thing every day. Now, where is the time to allow the child to think? Mommy, that a friend of mine actually took my pencil yesterday and I don't like him. Where is the time to explain, अरे कल पेंसिल लिया तो क्या हुआ, आज पेंसिल तुमको वापस देगा, या तुमने भी लास्ट वीक उसका पेंसिल लिया था. दोस्ती तो ऐसा ही, अरे नहीं बाबा, अच्छा ऐसा किया, अभी उसके साथ बात मत कर. All school teachers will tell you, parents come and fight with the school teachers now, saying, why is my child not on the first bench? Why is he on the second bench? Everybody wants binaries, yes or no, fight or flight, right or wrong, strong or weak, good versus evil. And that is reflected even in parenting. The world is getting increasingly polarized, and it is beginning with parenting, not with politics. But Lev Vygotsky, who is the world's best or at least my favorite psychologist, talked about the value of family and neighborhood as a scaffolding, कुंपण म्हणतो आपण मराठीत त्याला, the zone of proximal development that वेली ज्या असतात कुंपणाच्या, जो बेले होती है, since Neelam madam is there also, I'll speak in Hindi, वो बेले जो होती है वो उस फेंस को एक एक फेंस के स्टिक को पकड़ के ऊपर 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 चढ़ती है, और वो अगर फेंस क्लोज बाय हो तो बेले जल्दी से चलती है, अगर बड़ी बड़ी गैप हो तो बेले गिरती है और मर जाती है. तो दिस इज वेरी इंपॉर्टेंट दैट द चाइल्ड हैज टू बी विद चाची, मासी, बुआ, मामी, काकी, मौसी, आत्या, so that the child learns from all of people closest to himself. So later on, he learns the skills, how to develop with the school teacher, who may be from a total different background or a total different makeup, and yet the child learns. But unfortunately today, neighborhoods are absent. And no child, म्हणजे आपण शेजार कुठे नसताच आता. So the child is not only isolated in the family home, but there are no neighborhoods. And as my friend Dr. Ajay Gudavarti from Jawaharlal Nehru University, Neelam ma'am, you must meet him one day, says that we are living together but actually separately. And this is the article which he wrote for Outlook, that social structures are going away. And the child who is weaned not on humans or on nurturing care but on screens is unlikely to learn social maneuvering. तो काका जरा कुसका आहे, त्याच्याबरोबर कसं वागायचं, अरे ती मावशी एकदम चिल्ड आउट आहे, कसंही करू शकता. हा जो फरक काकी मावशीकडून शिकता येतो तो स्क्रीन्सवर शिकता येत नाही. आणि म्हणूनच अनफॉर्च्युनेटली टुडे पेरेंट्स हॅव नो नीड फॉर नेबरहुड्स. त्यांना काही फरक पडत नाही शेजारची काकी कशी आहे, मावशी कोण आहे. दे आर ओनली फोकस्ड ऑन एन अकॅडमिक करियर्स अँड ऑल दिस सोशल लर्निंग दॅट चिल्ड्रन शुड हॅव लर्न्ड इन द नेबरहुड इन द फर्स्ट 3-4 years ऑफ लाईफ. पेरेंट्सना वाटतं त्या इंटरनॅशनल स्कूलला टाका आणि द चाइल्ड विल पिक अप एव्हरीथिंग. बट स्कूल्स, माय फ्रेंड्स, आर बेस्ड ऑन द बायनरी. That is, schools are 1 + 1 is 2. It cannot be 3. You are either yes, or you are either right or you are wrong. You are correct or incorrect. It's either yes or it's no. Newton's first law is Newton's first law. It cannot be the second law. So school and education and academics are based on the binary. Human behavior is not binary. It is multiple that cannot be learned in schools. It can only be learned in the pados. But unfortunately, parents and all of us are taking children back to the binary, which is an interesting regression, because now we are shifting back towards emotional decision making, which is short term. आत्ताच्या आत्ता काय होणार, मला आज शाळेत मुलाला कसं पाठवता येईल, मूल पण विचार करतो आत्ताच्या आत्ता मी काय करू. नॅरो अँड सेल्फ सर्व्हिंग, एव्हरीबडी थिंकिंग माझं काय माझं काय माझं काय. And the real victims of this change are delayed gratification, going every OPD. मुलाला पेशन्स नाही, 2 मिनिटं बसू शकत नाही. अरे ट्रीटमेंट काय, एज मैडम सेड, ओटिस्ट, उसको टायरिंग करो, एग्जॉस्ट करो, रनिंग करो. अरे रनिंग करके बेहोश हो जाएगा आदमी तो स्कूल में जाके करेगा क्या. तो थकने से इज नॉट द ट्रीटमेंट. द ट्रीटमेंट इज टीचिंग द चाइल्ड डिलेड ग्रेटिफिकेशन, विच हैज गॉन अवे. देयर इज नो टाइम फॉर रीजनिंग, देयर इज नो टाइम फॉर लर्निंग एम्पथी, बिकॉज मदर नेवर सेड अरे त्याने तुझी काल पेन्सिल घेतली म्हणून काय झालं, तो आज तुला परत देईल, किंवा त्याच्याकडे पेन्सिल नव्हती म्हणून त्याने तुझी पेन्सिल घेतली रे. कुठे आता, there is no question of talking all this, because you have to catch the school bus in 5 minutes. So empathy is out of the window. Ability to resist impulsive thinking is out of the window. Do whatever comes to your mind, because I am also doing whatever comes to my mind, because I have to get you into the school bus. The interesting part is the increasing rates of suicide, because resilience is an ability which develops as children are nurtured within diverse experiences. Kaka asa तर काकी तशी, मामा असा तर मामी तशी, आत्या अशी तर मामी तशी. आणि मामा बरोबर कसं वागायचं, काकीकडे कसं वागायचं नाही, असं केल्यावर मामा चिडतो, मग आपण काय केलं पाहिजे. ऑल दिस कमिंग टू टर्म्स विथ फेलियर इज लर्न्ड इन द नेबरहुड or in the family, not at school. No wonder all the world's suicide prevention programs have failed to prevent the increasing in the number of suicides. Check it out if I'm right or wrong. And now comes the digital world. So don't start by blaming the screens, because all of us are blaming the screens. Have we been able to take the screens away? No. Why? Because screens are not the first problem. Screens are the seeds which you are sowing in the field, which has already been plugged because of the return to binary, because of lack of time, because of an absence of nurturing care, and because nurturing care is replaced by schools. Schools cannot give nurturing care. Schools can only teach binary, yes or no, 1 plus 1 is 2, correct or incorrect, pass or fail, promoted or failed. And in this increasing digital world, from infancy onwards, children are seeing this binary or these digital screens, which promotes digital interaction, taking the time away, whatever was left for human engagement. So one is that schools are taking away the human engagement time, but that was after 3 or 4 years. But now after 3 or 4 months, for a 4 or 5 month old child, there is no time for human interaction because digital interaction is taking it away. And that's why I'm calling this journey of the last 25 years from 2000 to 2025, the journey of Indian children, the dangerous journey from cradle to classroom, which is bypassing the nurturing care of the pados or the neighborhood, the scaffolding of family, which was essential components over generations. Don't say, आमच्या काळी असं होतं, आमच्या लहानपणी अरे हा काका मामा काय बोरिंग रे ग्रँडफादर कसलं तुझ्या काळी इट्स नॉट माझ्या लहानपणी काय होतं इट इज मनुष्याच्या लहानपणी काय होतं फॉर द लास्ट 6 million years. It is not an uncle giving some gyan about what was in his childhood. Don't listen to his gyan. This is evolution. This is how human beings have evolved. For all the evolution for human beings to reach where we are today, it required a childhood, it required a neighborhood, it required a nurturing care. If you've taken it away, you are destroying the essence of humanhood and humankind. And hence, going ahead, today family members are replaced by screens, neighborhood are replaced by schools. Suddenly, over a couple of decades, mankind has not evolved for it. And that's why today's children are presenting with anxiety, impulsivity, hyperactivity, poor attention spans, and tantrums, even at the age of 2, 2.5, even younger than that. And this is the real reason. So some research and publications that we had, where we worked upon it, and we said, and we postulated the New Horizons social behavior and communication milestones, where the first milestone is not academics, as parents want it to happen, or speech, which is needed to get into academics for the interview. But the real first step is human engagement, which leads to the child observing parents and learning behaviors. बेल वाजली तर आई जाऊन दार उघडते, बेल वाजली नाही तर आई दार उघडत नाही. दार कधी उघडायचं कधी उघडायचं नाही इज अ बिहेवियर. दार कसं उघडायचं is a skill. You don't need skills. You need to understand when to use skills. That's behavior. You do that by 8-10 months, a child starts learning pointing and gestures, non-verbal communication. Only after that can the child learn verbal communication. Only after that can the child learn reading and writing. These are the milestones. But if there is poor human engagement, as we see in a child with autism, then you get various symptoms like poor eye contact, no response to name call. Child doesn't know kadi dar udaise kadi nahi, is running to the door and back all the time. You are calling him hyperactive and you are giving him exercises like tiring him out and giving him some textural therapy. It doesn't help. That's why there is no pointing or gestures, and that's why there is speech delay. But the worst point is when the child is left with so many objects, especially the screens, the child focuses on objects instead of humans. Instead of human behavior, the child starts learning patterns and hence copies nursery rhymes, which is echolalia, as madam said some time back, and copies all kinds of actions without understanding the meaning. And hence these are how repetitive behaviors come up in children with autism. And these are the symptoms of autism. What New Horizons has postulated is there is a normal pathway and a deficient pathway which begins with the child. If the child has normal engagement to begin with, he develops normal social behavior and communication. But if the child's innate engagement is deficient, then he will go on to develop impaired social behavior and communication and RRBs. That is a road to autism, but the DSM-5 tells us that is autism. No, it's not. It's the endpoint, the symptoms of autism. The road to autism starts with human engagement. And what did we learn in our New Horizons program? That these sessions, which was talked about by Jaya Madam and Kashmiri Ma'am, are not important at all. Far more important is parent coaching, where you teach the parents that keep the child away from objects, increase the human engagement step by step. And the children that we are seeing now are increasingly becoming normal as compared to years and years of therapy, where children become patterned because therapies teach the child patterns. They don't teach the child how to behave with a kaka and a kaki or a mama or a maushi, because mama and maushi are different. You cannot use the same patterns to deal with them. And that's why after years of therapy, children don't become normal. But now what's going to happen is even more important, because in the last 2 or 3 decades, Human engagement was sacrificed for digital engagement. Increased digitalization and poor nurturing led to poor social cognition and behavior, as well as change in social dynamics. And you saw an increase in the people who had the autism gene because it worsened their epigenetics. It decreased their human engagement that they were getting from the environment. And that's why those who had mild genetic issues also started manifesting full-blown autism. But the problem is what's going to happen next from cradle as we go on to the AI cloud in the next 10, 15 years with generation beta. AI will further compound this scenario as it distinguishes the boundaries between the artificial and natural worlds, what is real, what is fake, and hence the coming generation will have no understanding of what is normal human social behavior. And as a developmental pediatrician, IAPN, my biggest concept is this generation, which is going born, will struggle to distinguish between what is artificial from reality, and they'll be going away from reality. Previous generations went away from social engagement and developed autism. This generation is going to go away from reality. And I consider AI is like a mutation because this is sudden. Our genes have not been given the time to evolve and adapt because genes take millions of years to evolve and adapt. 25 years, not possible. Again, children will be born to older parents and smaller families who may not have the physical energy to take the child to the park, etc., and will spend more time indoors, and hence more digital intoxication will happen. Again, the current generation at least had their kaki, mommy, or the father or mother who kept shouting, don't watch the TV, don't watch the screen, keep the phone aside. But the next generation will be born without this reference since their parents will already be thinking this is a new digital normal. So all this, dear friends, is going to put children at a risk of not understanding what is real and fake. And all these rubbish terms like digital native and AI, your children are digital natives, all American industry-driven rubbish. We are not digital natives, we are social natives. I am a native of चिपळूण. तुमचं नेटिव्ह प्लेस काय? माझं नेटिव्ह प्लेस चिपळूण. मी चिपळूणचा नेटिव्ह आहे. डिजिटल नेटिव्ह कुठून आलं? आपलं काय दादा परदादा काय मोबाईल वापरत होते की दॅट दे आर माय नेटिव्ह. डिजिटल नेटिव्ह रबिश. We are social natives. But parents are increasingly putting their child in technology, in schools which have technology. And IAP, Neelam madam, must consider this as a major impediment to children's well-being, far more than breastfeeding or any other feeding or any other weaning or any other nutrition, because this will impact their lives. And hence, what are the solutions? Last 5 minutes. Stop making excuses. Don't use false, fake narratives. Break them. Children are not digital natives. Children don't need AI to develop. 6 million years, you didn't need AI. Children don't need AI in the classroom or for education. Call to action, 5-point agenda for IAP that we should take up. Pediatricians, stop normalizing. नहीं बच्चा है, टीवी तो देखेगा ही, मोबाइल तो देखेगा ही, काय को तुम तकलीफ लेता है, मत देखने दो उसको. बच्चे आजकल यही करेंगे. No, do not agree to this. Fight against it when parents tell you this. Instead, you say कि नहीं, तुम्हारे बच्चे को काकी, मौसी, आत्या, मामी, मित्र, मैत्रीण सब जरूरी है, मस्ती करना जरूरी है, बाग में जाना, गार्डन में जाना जरूरी है. IAP must mandate parks and open spaces with the governments. That's why we need a separate ministry for childhood and adolescence where children can mingle and interact in parks and open spaces. IAP must mandate limiting the influence of technology, no technology inside the classrooms. And IAP must say that work at most families, most parents, nuclear families, they will be busy at work. Schools, in fact, are the only place which must begin nurturing care and must stop too much of academics and instead go back to fulfilling the role that neighborhoods used to fulfill earlier. But it's unfortunately going the wrong way. What are the parenting tips for newbie parents? What is a suggestion for neonatologists? All the neonatologists are very good now. We write on the discharge paper, screen for ROP, screen for audiometry, screen the growth charts, vaccines, developmental charts, monitor all that. Very important. Instead of all this, in addition rather to all this, tell the newbie parents when you are going home from the NICU, limit your child's exposure to the digital world, eliminate as many forms of digitalization as possible, buy lesser gadgets. Tell the parents, तुम्हारा 2 महीने का बच्चा है, provide a scaffolding. Show children the value of kaki, maushi, atya, mommy, sitting with friends, sitting with relatives, sitting, chit-chatting, playing games. Parenting tips for adolescent experts. Very important. Human engagement powers learning. Let's put children first. My first suggestion for adolescents is prioritize behavior over skills. दरवाजा कैसा खोलने का फर्क नहीं पड़ता है. दरवाजा किसके लिए खोलने का, किसके लिए नहीं खोलने का, उससे फर्क पड़ता है. कपड़ा कौन सा पहनता है फर्क नहीं पड़ता है. क्या पहनता है, किधर नहीं पहनता है, वो समझना जरूरी है. Prioritize adaptation over academics. By hearting Newton's first law is of no use, but understanding that action and reaction will be equal and opposite, even in relationships, is very important. Will they be able to adapt or only stick to academics? Prioritize participation over performance. मेरा बच्चा हर क्लास में फर्स्ट आता है, वो एग्जाम्स जाता है, मेंटल मैथ्स करता है, ये करता है, वो करता है, फर्स्ट आता है. अरे पार्टिसिपेट करता है क्या, नहीं घर पे बैठ के मोबाइल पे पढ़ता है. इट्स नॉट गोइंग टू हेल्प. Participation is more important. So parenting tips, don't rush your children in multiple activities, because all these activities make the child more self-obsessed and hence more isolated. Very important, make a group of parents that will have each child come to their house once a week. Make a group of 6 mothers. All children go to that mother once a week. Other mothers take turns. Each child gets 6 houses, 6 mothers, learns 6 different cultures, goes away from the screen, in fact, learns better tolerance, better delayed gratification by living and going to different houses. And hence, doctors are doing group practice. Please tell your parents also to do group practice. And that's why very important, take the child in the community to serve others. All these opportunities are now not available because no neighborhoods. In Mumbai, I tell my patients, Gurudwara leke jao, oh, Mandir, Masjid leke jao, not for just prayers, but to live and understand how to serve at the langar, झाड़ू कैसे लगाने का, वो सतरंजा कशा बिछवायचा, and all this is going to help them understand how to serve others, because today you can survive only if you serve others. Nobody will bother with you if you are no use to them. So all of us who give these lectures about inclusion, blah, 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 the only inclusion is when you teach the child to serve others. Only then the society will include your child. Otherwise, nobody gives a damn for your child. If your child is not able to help others, no government, no legislation can provide it. So my definition of nurturing care is learning to adapt to different practices, different habits, different beliefs, different situations in small, slow measures. पहले मम्मी डैडी, फिर दादा दादी, फिर चाचा चाची, फिर मामा मामी, फिर neighbors, फिर school, and helps the child develop self-regulation better. So the chachi, masi, bua, mami are far more important than some Samir Dalwai or some child development center. And hence, this is the human engagement that powers learning. It takes a village to raise a child, but a neighborhood to raise a citizen. What are the laws all of us should follow? And it takes social engagement to raise a normal child. And hence, these are some references. If you want, you can take a screenshot and use the QR code to go to all these videos. We have no time, so I won't play these videos, but you can take a screenshot and go and check it out on the website or on Instagram. These are the articles that I told you about. If you want to share it with your parents, take a screenshot. Feel free to share it. You can add your name. No problem with that at all. It's all free. So what we are understanding is, throughout history, we thought solitary confinement was the worst form of human punishment. Kala pani, worst punishment. Look at what we are doing now. We are pushing our children into the kala pani, isolation, social isolation, solitary confinement. Look at what's happening to the child. All of us are complaining AI will take away jobs. AI is eliminating human employment. Yes, it might be a worry, it might not. Are you understanding that AI is going to eliminate human engagement? Forget the employment. It is eliminating human engagement itself. So, dear friends, stop making excuses. There is no time for tomorrow, because the last 25 years, we saw an unexplainable, unimaginable, unprecedented, unpredicted increase in autism spectrum disorders. If you do not break this connection between AI and newborn children now, 2025 onwards, it is my prediction, and please pray that I am wrong, we will have a huge epidemic of psychotic spectrum disorders. Thank you very much. Let's remember, let's put children first, because that's the most important priority today. If we do not do this, it's going to be the worst challenge that mankind and humankind and womankind has ever faced. It's not about माझ्या लहानपणी काय होत होतं. It's not some uncle talk. It's evolutionary talk. कारण in mankind, for humankind, this has been happening for 6 million years. 25 years, you are changing it. Genes haven't evolved. You are calling for a disaster to happen. So let's get together as IIP and let's put children first. Thank you very much.
Thank you so much, sir. That was a very
Amok, sorry, I forgot to mention your name earlier. Thanks a lot.
it's been a very wonderful presentation, very emphatic and very passionate as usual from you. Like how you said, going from the cradle to the classroom and then from the cradle to the cloud. And like the simple Jadoo Ki Jappi, I think goes a long way in bringing our kids back to reality and away from the digital world. Like how everybody says nowadays that the Zen Alpha and Beta are actually global citizens. So I guess now we have to put a full stop for all these misnomers and get them back home. So that was a wonderful presentation. I would like Dr. Neelam ma'am to give her expert comments before we take a few
Yeah.
minutes.
At the onset, I just wanted to ask you one thing. समीर, फर्स्ट ऑफ ऑल तुमने बहुत ज्यादा मराठी में बीच में बहुत सारे डायलॉग्स बोले, तो यू विल हैव टू गिफ्ट मी अ बुक, ताकि मैं वो पूरी बुक से ऐसी मराठी पढ़ लूंगी कि 2 साल बाद तू मराठी में जितने बोलेगा पूरा जवाब भी मराठी में दूंगा.
क्योंकि मैडम
सो यू सेंड मी अ
2
बुक,
घंटे में बुक पढ़
बिकॉज
लेते हैं.
काफी डायलॉग्स में मिस कर रही थी, बट इमेजिन कर रही थी ये क्या बोल रहा है.
आप बस
सेकंड, मुझे
महाआईपी
एक चीज
प्लेटफॉर्म पे
पूछना है
आते जाते
तुमको.
रहिए. आप जस्ट महाआईपी प्लेटफॉर्म पे आते जाते
वाह,
रहिए. प्यार और मराठी ऐसे ही हो जाएगा.
मराठी आहिस्ता
By,
आहिस्ता आ जाएगी.
by the time your
अच्छा, नहीं, मेरे को ये
tenure
समझाओ.
starts, madam, you'll be fluent in Marathi.
ये बिकॉज संजय को मेरे साथ काम करना है, ओपनली बता दी हूँ. अच्छा, चले. तो अभी मेरे को ये समझाओ कि which stage in life, Samir, did you decide to go for this branch children first, number one? And how many kaki, mami you had at home? What was your background that has happened? And this is outside syllabus question.
I love you for this. And you have really touched a very raw nerve. And I am really going to tell you this. Every so-called scientist, it is known, has a bias from his or her personal life. Whatever greatest
Correct.
है, हम लोग
That's
तो
why
कुछ
I'm
भी नहीं है.
asking.
हम लोग तो कुछ भी नहीं है, but my bias is exactly what you said. And I don't know how you have picked this up, because I grew up in a childhood like this. I was born in one culture, I was raised in another culture, I went to a school of another culture. Even my saga bhai bahan are not able to adapt as much as I can. Not even they. I was born in a household which were the Dalwais, which had a different behavior. I was brought up by the Zoshis. And everybody in the child neighborhood thought I'm Samir Zoshi. Till I had to tell them, no, I'm Samir Dalwai. And then I went to a convent school where it was all nuns and everybody and priests. I cannot tell you, and you have really, really opened that raw nerve today. This is exactly why I came up with all of this. Because I could see it changing and I could see it with the developmental behavioral practice. And I cannot tell you how emotional I can be about it. And that's why I feel worst when I see
I
children
heard
coming with an
you last
autism
time,
diagnosis.
but I can. Yes. But you don't believe that it has got anything to do with screen, because majority of the people say that it can aggravate, but not. What is the connection between screen and autism?
I was bringing that up today, that it's actually the social behavior which is far more important than screens, because the social behavior has already pushed children towards the edge. The screen is just tipping them over. So stopping screens is important, but just stopping screens is not going to bring back the normality in childhood. The social nurturing environment also has to be brought back. And that's why parents are not able to stop the screen, because screens can only be replaced by human beings. Just telling them a lecture, screen band karo, no good.
But living with them, it is so difficult. Sometimes I feel that you need to have some society, something more I feel terrible when I see children who come to me and they are breaking things around in my so-called, delicately done room. You won't believe I'm not able to concentrate to write the prescription with that stress ki kya hone wala hai. And then that 20 minutes, 15 minutes child hone ke baad, I am confessing that 10 मिनट बाद बोलती मैंने चाइल्ड को देख लिया पूरा समझ लिया अगर उसको बाहर रहना है तो वो जा सकता है you can play with the balloon or whatever. So what I'm trying to say is कि उस माँ पे क्या गुजर रही है जो आपको 24 घंटे है मैं उसको बोल रही हूँ जाओ तो I really don't know whether it is the child or we should have seminars for the caretakers rather than the children because we've reached a state when you talk about the future and अगर ये ऐड करा तो नीचे छोटा सा कोट कर्टसी नीलम डाल देना कि तेरे फ्यूचर में मींस ये इतना बढ़ जाएगा तो it's like a murgi and anda and what is going to happen to the parent I mean that person and that is why the mother tells me when she comes in the room madam मैं घर पे नहीं देती हूँ बट मैं बाहर आई हूँ ना तो मुझे आंसर as long as she's going to be with me in the clinic, she will say मुझे देना ही है because मैं घर पे नहीं देती हूँ. But the way the child holds it so comfortably, I get very surprised कि ये बारी इतना comfortably use कर रहा है तो he knows all the programs. But something more needs to be done for the caretakers. जैसे वो 6 दिन आपने बोला that was so interesting कि Monday to Saturday एक ही आदमी जब 2 के लिए काम कर रहे हो तो 12 के लिए कर दो. एंड 5 days यू गेट अ छुट्टी सो अगर कुछ इस तरीके से ऑटिज्म सोसाइटीज या कुछ ऐसे आप जैसे महारथी लोग करें कुछ सोचे बियॉन्ड द बॉक्स तो दैट्स अ गुड थॉट आई मीन आई डोंट नो जस्ट अ थॉट दैट comes in me that it is quite difficult to caretake but I really enjoyed the insights which this lady gave at a speed of UVW. She was not XYZ, she was not too fast, but she was speaking at UVW, and you couldn't just move around or even you had to be extremely alert to catch up with what all she was sharing. And it was very beautiful, Kashmiri, to have given that insights in this beautiful colored tables. It is so important to know how to deliver, and you delivered it very beautifully. And I love the F's you talked about, besides the 5 F's, the 6 F's, the finance, and all that stuff. That was very, and Jaya ma'am had obviously things which sadly are not written in the books, but she wanted to talk about her wisdom. And we salute her for thinking about all this so many decades back. And I would once again thank Sanjay and Amol for thinking about me on this, a platform. And today I don't know whether it was तारीफ या शॉल लगा के पीटना मुझे नहीं मालूम. There was a triple E program where Sukumaran said कि Neelam came to our conference and she was listening to others too. So Dr. Vasan decided that I should get the award for best listener. I said, sir, ऐसे तो बोलो कि best academician. मतलब अगर तारीफ ही करनी थी बेस्ट लिसनर इसको लिसनिंग में डाल दो अरे लिसनिंग में नहीं somebody is talking about mycoplasma how it is behaving in today's era we want to know because तुम्हारे बच्चे को भी किसी को माइकोप्लास्मा हो जाएगा so it is like as Samir said probably मेरी addiction is academics so I get very addicted when I'm called for such forum. So thank you and wishing Maha IAP all the programs that you all do are amazing, amazing. I enjoy it. And there is what a simplicity and humility in you all. Please बदलो मत वैसे ही मराठी में बात करो बदलो मत गंदे मत बनो ऐसे ही रहो simple and nice and with each other. और मुझे बुलाते रहना मैं प्रेसिडेंट नहीं भी हूं तो
अभी तो प्रेसिडेंट बन जाओगे मैडम.
हाँ नहीं, जब मैं नहीं भी रहूंगी तो बुला लेना, ये बोल रही हूँ।
बिल्कुल बुलाएंगे, बिल्कुल बुलाएंगे।
Always, madam.
Yeah. And best wishes to all the team. Maharashtra is coming out with 5 खिलाड़ी. Best wishes to all. और क्यों नहीं, क्यों नहीं, कुछ करके दिखाओ. मुझे ऐसे लग रहा है कि 5 खिलाड़ी हमारी जॉब ले ही लो. ठीक, ओके जी.
Thank you, madam, for joining us
But
and attending today's session. We are indebted to you.
Thank you, madam, for those wonderful words, for encouraging us. If there's time for a couple of questions, Dr. Jaya ma'am, can we take a few questions?
There were few questions regarding the schooling
Yes.
and the comment on OT, occupational therapy. So, yes, schooling depends on too many things. And again, I think it's a separate topic itself. And we will find some day in coming days to talk exclusively on schooling and education of children with autism, because it cannot be covered in 1 or 2 sentences. So we'll definitely take up this topic sometime. We have Sunday sessions of Palakatva also. So there also we can take up this topic. And for that matter, tomorrow we have a session with CRC, that is Composite Regional Center Nagpur, which is for parents and special educators. So there Dr. Kashmiri is going to speak on behavior, and I'm going to speak on education of children with autism. So maybe we'll share the link for tomorrow, and those interested can attend that. And regarding occupational therapies, yes, it needs to be individualized. We don't have to highlight it too much because we have seen problems coming up. So integrated therapy and connection with the family and parent training. Yes, we need to do that. So actually, too many things have come up in this session with Dr. Samir Dalwai taking this session to a very higher level. Many things to ponder upon, many things to, actually we feel we need to work with system and bring some constructive change. So great session having all of the experts here. So if there are any comments, we can take up it, or I will go ahead with the vote of thanks. Any comments from the participants? We have few minutes.
Jaya, madam.
Yes.
Madam, I have one question from Samir sir. Samir sir,
Yes.
are you there?
Yeah, sir. Bolo.
Yes. Samir sir, I just post in the chat box also. Nowadays the people are opting for the open school concept. I don't know exactly what the word is there, but you must be surprised in the tribal area in Gadchiroli. Most of the educated parents are going for the what you call the non-conventional schooling. So your comments, sir, and what is the schooling concept?
No, I don't know about what's happening in Gadchiroli. Open NIOS, if you are asking me what that is, National Open University, that is basically a system where you don't have fixed syllabus and fixed year-wise syllabus. You can take the subjects as you like. Other aspect of homeschooling that is being confused with open schooling is that the child doesn't go to a school at all, and there is some syllabus that is being given from a university or a board for at home, either with tutors or with the parents becoming the tutors. My point is, going to the school is very important because that is the further step of social development. But going to the school when the earlier steps of social development are not completed is like going for a running class when you are not even able to stand. So that is the problem of developmental children who are developmental disorders going to school without having achieved that level necessary for school, then be given shadow teachers, etc. So about open school, my thought is basically till the children develop these skills that are required for age-wise syllabus, they should be taught separately so that they can build up their skills slowly. But if I have not answered that question correctly, I can request Jaya madam or Kashmiri ji to answer that as well.
Yeah, Gadchiroli, the preference for open schooling is because of the security, social reasons. It is not because of any disability or other things in child, because the environment is not safe to send the students to school, so they prefer open schooling. The national open school which the government runs is specifically with the same syllabus as CBSE school. So syllabus is not altered. Only thing is it has flexibility, and it is meant for sports person or other achievers who cannot go to school. It's a misnomer that it is basically fit for children with disability. It's equally difficult. Only
ma'am.
thing they have some subject options and flexibility. So tomorrow we are having session. Maybe I
Okay,
will
ma'am.
share a link. We are going to discuss in detail about this. Yes,
First
Dr.
of all,
Devendra.
First of all, congratulations to all the speakers. Spoke so extremely well, very well spoken. And Samir sir has very rightly said that the social atmosphere is very important for the child. We have seen that in my experience, the children who are living in the joint families, they were learning from their elderships, from the nearby also, and from the neighbors also, and playing outside, beating each other, and then coming, being friends like that. But nowadays, with the civilization, the parents are taking care of the child in a way that it is overprotected. So these overprotected children are more prone to develop the behavior disorders. So, and living in the, previously they were living in the open houses, and very much communication with each other. But nowadays they are living in the complexes and no interaction with the even the neighbors also. So I think these are also he has very rightly said that the social factors are far very important and vital. Thank you very much. This I wanted to say.
Thank you. Thank you.
Wonderful sessions, ma'am. Really, it started with Kashmiri's presentation of autism, how is multidisciplinary approach, then your experiences in the last 25 years, and the generation next talk by Dr. Samit Dalwai. So really means last 1.5 hour was really wonderful, and I think those who have seen this program they might means take the advantage from the our YouTube channel also. I think it is going to benefit them all, and it was a great academic feast for all of us. Thank you, thank you so much. And
Thank
again,
you.
Amog, you have done a great job.
Thank you,
Thank you,
Amol.
sir. Thank you for the
Thank you,
opportunity.
Jaya madam. Thank you, Kashmiri ji. Very well
Thank you.
spoken. Jinam
Actually,
ma'am, Devendra
Thank you,
sir,
sir.
Sanjay bhai,
Thank
both
you,
the Sanjay
everyone.
bhais.
Thank you.
yeah.
Thank you.
Kiran bhai.
Thank you, sir. Thank you. Thank you.
Thank you.